There are 4 areas that cerebral palsy affects: muscles, general development, intellect, and emotions and behavior. Number 1, muscles. Since CP most commonly affects the area of the brain responsible for movement, there are many muscle-related disabilities to look out for. A few common ones are shaky movements, abnormally stiff or loose muscles, difficulty in grasping small objects, and less movement on one side of the body over the other. Number 2, general development. Sometimes, along with muscle-related abnormalities, a child may have developmental delays as well. Some things to look out for are if the child doesn't roll over by 4 months or doesn't learn to talk by the age of 2. That said, different children hit these milestones at their own ages. Even if they're running a bit late, that doesn't automatically mean that they are developmentally deficient at all. Number 3, intellect. Although children with CP often have average to above average intelligence, about 1/3 of children are cognitively impaired. This means that they may have trouble remembering, learning new things, concentrating, or making decisions that affect their everyday life. Some common signs are not learning to talk by the age of 2 or not understanding basic grammar by the age of 5. Number 4, emotions and behavior. Children with CP often have a low self-esteem. They may also have excessive anxiety, mood swings, or temper tantrums. As such, unless a child's cerebral palsy is very mild, parents can expect certain differences to exist between children with CP and those without CP. But different isn't a bad word. There is an abundance of therapies and assistive devices out there to help parents and children live fulfilling, fruitful lives together, no matter how severe the CP may be. Generally, signs of cerebral palsy appear within the first few months of a child's life. However, it's possible for there not to be a conclusive diagnosis until the child turns 2 and even older. Children with CP can show a wide variety of signs, including stiff or tight muscles and exaggerated reflexes, delays in reaching essential motor skill milestones, such as rolling over or sitting up, abnormal muscle tone, either rigid and stiff or weak and floppy, weakness in one arm and or leg, lack of muscle coordination, walking on toes or with a crouched gait or scissored gait, shaking or other involuntary movements, and excessive drooling or a difficulty in swallowing or speaking. If you're concerned that your child may have cerebral palsy, here are a few early signs to look out for. For children until 6 months of age, the baby's head may lag when picking him or her up or while lying on his or her back. The child may feel especially stiff or floppy, or when picking the baby up, his or her legs stiffen or cross like scissors. For children above 6 months of age, the baby may not be rolling over in either direction, the baby can't bring his or her hands together, the child may have a hard time bringing his or her hands to his or her mouth, or the child may only reach out with one hand while keeping the other hand in a fist. For children above 10 months of age, the baby may crawl in a lopsided manner, pushing off with one hand and leg while dragging the opposite hand and leg, or the baby may not be able to stand without support. If you notice any of these signs with your child, you should have him or her checked out by a pediatrician as soon as possible. The sooner cerebral palsy is diagnosed, the sooner treatment can begin to help your child acclimate as seamlessly as possible. Thanks for watching our video. At CPNeeds, just as it's important to learn about cerebral palsy, we also want parents of CP children to be part of a community. So, which type of cerebral palsy does your child have? Do you have any advice? Comment below.
If you want to learn more about this topic, or you want to see more videos about cerebral palsy, please subscribe to our channel and come visit us at cpneeds.com.